Hi, this is Brian Kim. I want to share with you case number 97 in the best way to do cataract surgery series. This is a moderately dense lens with a pretty big pupil. And you're going to see double chop, cross chop, mechanical fracturing techniques, and how I'm able to mechanically and systematically disassemble this lens. Again, I'm able to use reduced amounts of ultrasonic energy. And the reason I do it this way is because if I was having this surgery, or for my family member was having this surgery, this is the way I would like to have the cataract surgery done. So that's the basic principle. So I'm using a cotton tip to steady the eye. I'm using a corneal marker, which will help me to center and size the rhexis. Make my paracentesis incision first on the right side and then the left side, and making sure I make a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine and then some dispersive viscoelastic to fill the chamber. Use a cannula to hold the eye, and when make my triplanar corneal incision, I make a vertical groove, place the blade into the deep part of the groove, turn the eye away from me, make a nice tunnel, turn the eye towards me using the cannula, and then enter. Push some more viscoelastic at the end, and then go in with my puncture style rhexis forceps, go in with the teeth sideways, puncture the center, hold downward towards me. Sometimes the tear moves to the side with the teeth closed. I gently kind of encourage it to come towards me. Grabbing the right side of the tear, I go ahead and go around creating the flap. And I try to follow the corneal mark that I made, which will hopefully allow me to achieve a well-centered and sized rhexis. Finish off the rhexis, burp some viscoelastic out, and this is the Capsulorhexis hydrodissection technique. Place the cannula under the rhexis edge contra-incisionally, point the tip down, get a nice wave, point the tip back up, decompress on the left, point the tip down on the right, and then you can see the lens spins nicely. Irrigating the surface of the eye, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, placing the chopper underneath the rhexis edge contra-incisionally, the Phacotip vertically sub-incisionally, bringing both instruments together, which crushes and bisects the lens in half, placing the chopper around the right heminucleus, pulling it centrally toward the Phacotip, and then crushing and bisecting the right heminucleus. Using some vacuum to lift that first quadrant up, getting the chopper around it, crushing it, and bisecting the lens piece into smaller pieces, and then emulsifying the lens pieces. Placing the chopper around the second quadrant, pulling it centrally toward the Phacotip, bisecting it, lifting it up, and then crushing it between the instruments, using some vacuum, crushing it again, and then emulsifying the lens pieces. So again, the principle is using the chopper like a knife and using the Phacotip like a chopping block. I turn the second heminucleus in front of me, placing the chopper around the lens piece and pulling it centrally to crush it against the Phacotip, using some vacuum in the chopper to crush that third quadrant, and then emulsifying the lens pieces. Getting the chopper around the fourth quadrant, pulling it centrally towards the Phacotip, crushing and dividing the lens, and doing the same maneuver again, crushing the lens pieces, and then emulsifying the lens pieces. Once the endonucleus is removed, I'm removing the epinucleus, which tumbles out quite easily here, keeping the chopper deep in the bag while I do this. Take the chopper out, push BSS in, take the Phacotip out, and then I go in with the INA handpiece. The bag is fairly clean, but invariably there's some very fine lens material, cortical material left. So I'm polishing around within the bag, especially in the subincisional area there. Switch to polish mode and polishing under the rhexis edge here. using the cannula to pulse the subincisional space, which is able to liberate that lens material in the subincisional space. Using some cohesive viscoelastic to fill the bag. And then I'm using the sweep to polish underneath the rhexis edge. First on the left side and then the right side. So I'm injecting the single piece acrylic lens into the capsular bag. And then quickly transition to the INA handpiece, inflating the anterior chamber, disengaging each haptic off the optic, going underneath the lens, tilting it, rotating at 90 degrees, ensuring all the viscoelastic is removed from within the bag, and also ensuring that both haptics are within the bag. Repositing the optic down, polishing underneath the rhexis edge, cleaning any potential material that's there, switching to visco mode, removing all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a fairly dense lens, moderately dense lens, and I'm just really trying to illustrate the double chop and cross chop technique. Again, you want to think of the chopper as a knife, and the phaco tip is really the chopping block. It's like a cutting board. And so when you're chopping with the chopper, it needs some counterforce, and that is the chopping block or the phaco tip, and it allows that lens material to be cut with the chopper as it's being moved through the lens material towards the phaco tip. By using the technique like this, it really reduces ultrasonic energy. I'm able to have clearer corneas, and this is really very systematic way to disassemble the lens. You're using less ultrasonic energy, using less vacuum, hooking the lens pieces up out of the bag, out of the capsular bag. This reduces the risk to the posterior capsule, reduces the risk for complications. And like I said before, I always try to do the surgery as if this was a family member or for myself. And so I try to do the surgery as if it was my own eye, try to minimize trauma to the eye, try to do everything as safe as I can. And so this is why I call this the best way to do cataract surgery. The best way, of course, is very subjective, but this is the best way in my mind. And if I was having this surgery done, this is what I would like to be done if it was my own eye. So I hope this was helpful to you, and I thank you for your attention.